Okay, with me now is Dr. Natasha Crowcroft, Vice President of the Infectious Diseases and Vaccination Programs Branch with the Public Health Agency of Canada. Thanks for being with us today, Dr. Crowcroft.
Thank you, Carolyn, for having me on the show.
It would be easy to say get vaccinated, but somehow that message is not penetrating. So what needs to be done here to end this outbreak?
Well, the good news is the outbreak is on the way down, so that we are actually heading in the right direction. And that's partly because of the action that our public health departments have taken locally, particularly in the provinces that have been most affected. So that's Ontario and Alberta, as you said. This is really an unprecedented outbreak. So it's not about Canadians in general not getting vaccinated. This is happening because particular communities have been wary of vaccination. And even the Pan American Health Organization recognized fully that this was an extraordinary outbreak. It doesn't just affect this country, it affects several other countries linked together internationally. And so it's much harder to address it because it's local, very, very localized in particular communities. What we haven't seen in Canada, which is really good news, is general spread in the whole population. And that means that in general, people are actually accepting vaccination. We've seen a big increase, like you said, in Alberta, but actually across the country, we've had a doubling in the supply of vaccines to people. So Canadians have really stepped up in response to this outbreak. And it's interesting to see, if you're a parent, for some parents, I think measles was a theoretical risk. It's something that may never happen. They had never seen a case. They hadn't heard of anyone getting measles until last year and this year, when suddenly measles was spreading across Canada. And that was a wake-up call that people listened to, and they stepped up and got their kids vaccinated. So everything's pointing in the right direction. Unfortunately, we couldn't stop the outbreak completely in time to lose our elimination status. But the direction of travel is that we will get it back. This outbreak will come to an end, and we will then work to get our elimination status back.
I just want to underscore what you're saying there. You are confident that Canada will regain its status of eliminating measles.
Yeah, it's a risky thing to say because I don't want to be proved wrong on this. It'll take us time. We have to finish this outbreak. The outbreak has to be declared over first. Once the outbreak's declared over, then we will have to work for 12 months to sustain that lack of transmission. And at the end of that 12 months, we have to prove to the Pan American Health Organization that we have no transmission going on and that our surveillance systems, the monitoring systems are good enough to prove that we've got no transmission, and also show that our immunization coverage is high enough. And that's something we have really lapsed on over the last few years. Coverage has fallen. We've had this good response to this outbreak, but we need to get it back up routinely so that all kids get the vaccines they need, all of the doses they need on time.
Dr. Crowcroft, you mentioned that these outbreaks are localized in particular communities. What more can you tell us about those communities and the efforts that are being made to reach the people there?
So there are several communities in Canada that are a bit hesitant about vaccinating their kids. And the efforts that have been made, which the Pan American Health Organization really strongly recognized, involve building relationships at very local level with those communities and having people from those communities working in the public health department. The Pan American Health Organization, our colleagues there visited Canada in July, and they came to Alberta, they came to Ontario, and they met with the local public health folk and heard about the efforts that are being made. And they were really impressed by what we were doing. And they took those lessons from Canada and took them away to other countries where similar communities live, including the US and Mexico and other countries across the Americas. And that relationship building is really key to building trust. The most important thing we can do in an outbreak is to vaccinate. Really, the only thing we can do to stop an outbreak in its tracks is to vaccinate as many people as possible. But when you're working with communities that are not really sure about vaccination, there are other things we can do if we have that trusted relationship. And those include making sure that people don't mix with other people when they're sick, because it's so infectious. And that if a child is sick and needs to come to hospital, that they call ahead to make sure when a child gets there, they're really carefully kept in isolation so they don't expose anybody else. So there are measures we can take to reduce the spread in these communities, and that's the kind of work that's been done at local level. None of it works unless you have good relationships.
And can you tell us more about these particular communities? We're seeing spikes in Alberta and in Ontario. Are there commonalities between communities in either of those provinces that we're seeing?
The commonality is really connections between them. The very first cases occurred in New Brunswick at a wedding, and there's nothing better than a wedding for spreading measles because of, you have every age group there and they're all mixing together. And that first case was the strain of measles was actually linked to Thailand. So once the virus gets into Canada, into a community in Canada, and it starts to spread, it can get into any community that's not fully vaccinated. And with the travel within Canada, we know we have cases of people who traveled with measles on a plane, exposed other people who then got sick. And so that's how these communities got linked together. Some of them directly from the wedding, and some of them from people who traveled home from the wedding and then exposed other people when they got sick. The best way to prevent this happening is to go out globally and stop measles spreading in other countries. So supporting the global goal to eliminate measles so that there isn't measles in Thailand, there isn't measles in any other country in the world. Because as long as there's measles somewhere in the world, it can get on a plane and come to Canada and it can cause a problem here.
All right, thank you for your time today. That's Dr. Natasha Crowcroft, Vice President of the Infectious Diseases and Vaccination Programs Branch with the Public Health Agency of Canada.